So this summer team impact project this year is conducted by Dr. O, Dr. Park, and myself. And our topic examines two things. One is looking at ethnic community, older adults, civic engagement, social participation. And the other one is Dr. O's research question, which is examining their e-health and digital literacy and how they access healthcare.
Our research focus is on older adults, particularly from immigrant communities that have limited English proficiency in the DMV area. And so we're trying to kind of pinpoint those gaps in the healthcare system in this area. And so hopefully by focusing on those issues that we can use our data to make the DMV a better place for immigrant older adults to live in.
This is really a rare experience in that they have a they will have a rich experience taught by the faculty member from the step that how they can set up the research question, and then they can also gather data through the survey but also interview. And then also they are going to be taught by the faculty, and then they are going to implement accordingly how to analyze those qualitative and then quantitative data analysis, and also how to interpret those results.
I think that there are not too many projects like this one. So the idea is to confirm some of the ideas that we already have planned, like lack of access, lack of understanding, the distrust of some community groups about things that they may be government funded. But on the other hand, we are trying to identify the real gaps that the communities have, all the diverse communities, that perhaps we don't even think about it. And that is the important piece of the project.
Our job is basically getting information and details on the well-being of the older adults. Basically, we go out, talk to older adults, ask them if they could be a part of our research.
I just had a few weeks ago an interview with a guy from Guatemala, and he explained how the healthcare is so different in Guatemala. Even though we are Spanish speaker communities, every city, every country is so different, and they have their own ideas, their own bios, their own stigmas. So I think that's what is the most rewarding about this project, trying to learn new cultures, new ideas.
The goal of this research is just to make the older people's life a better place to live in the DMV.
Right now, what our technical team is doing is contacting senior centers, trying to see if we can go and conduct in-person surveys. That way we can get a larger turnout.
So I think in terms of like what we want for results, we want to see where society is at and see how we're able to help impact society in a way that will better help e-health and digital literacy among minorities.
Well, I just hope this study helps and works for like future generations, because we have been working like hard on this, and I hope like especially the Hispanic community gets the help they need through this project.
I personally like making a website development, and also I involved in focus group interviews. I liked it because we connected to two different communities and got to know about the communities.
I think it's one of the wonderful experiences I've ever had, because I'm an introvert person, so during the semester having a direct relationship with professors was not easy for me, but this summer team impact project is helping me to have a direct relationship with professors and my student friends. So I think it's a very nice opportunity that I can have during the summer.